Students, now you're going to start your fifth semester subjects. So the fifth semester you have child health nursing, you have mental health nursing, you have community health nursing including environmental sciences and epidemiology. You have educational technology and nursing education and introduction to forensic nursing and Indian laws. Now let us see in details about the fifth semester subject. Now the fifth semester subject, you have child health nursing, mental health nursing 1, community health nursing including environmental science, epidemiology, education technology, nursing education, introduction to forensic nursing and Indian laws. And there is a mandatory module you are supposed to complete, that is IMNCI and for child health nursing you have mandatory modules to complete. So we will see in detail the fifth semester subject. First one is child health nursing. Child health nursing, you have theory 60 hours, skill lab for 40 hours and for clinical 160 hours. So these are the main competencies which you are supposed to achieve at the end of the fifth semester. In child health nursing, you have to develop understanding of the history and modern concepts of child health and child health care, describe the role of preventive public pediatrics and perform preventive measures towards accidents, identify the developmental needs of children and provide parental guidance. But this is the course outline for child health nursing. You can see first unit, introduction, modern concepts of child health, 10 hours theory and 10 hours lab, skill lab. And the unit 2 is about the healthy child, 12 hours theory, and unit 3 is nursing care of neonate. Unit 4 is integrated management of neonatal and childhood illnesses, and unit 5 is nursing management in common childhood diseases, and unit 7 is unit 6 is on childhood emergencies. The books which you are supposed to refer is Marlowe D, Wong D, Premlada T, Asuma Bibi. These are the various recommended books for child health nursing subjects. Susama, Susmita. You can go through these books. In clinical practicum, you have 160 hours of practicals. At the end of the practical, you should perform assessment of children, health, development and anthropometry, provide nursing care to children with various medical disorders, recognize different pediatric surgical conditions, malformations. Various procedures you should complete is administration of medication, oxygen administration, application of restraint, specimen collection, urinary catheterization and drainage, feeding, wound pressing, suture removal. So clinical practicals in pediatric medical wards, you will be posted for 2 weeks. There you are supposed to complete nursing care plan 1, case study presentation 1, health talk 1, and in a pediatric surgical ward also you have to spend 2 weeks. So you will complete nursing care plan, nursing case study presentations, assessment methods is also given, and pediatric OPD and immunization clinic. You will spend 1 week. There you have to assess growth and development study for infant, toddler, preschooler, schooler and adolescent. So that's all about child health nursing. Now coming to mental health nursing. In mental health nursing, you have 60 hours of theory and 80 hours of practicals. The competencies on completion of the course, student will be able to trace the historical development of mental health nursing and discuss its scope, identify the classification of the mental disorders, develop basic understanding of the principles and concepts of mental health nursing, and so on. So you can see that up to 11 objectives are there in the course outline. The first unit is about the introduction, 6 hours theory, perspectives of mental health. And the unit 2 is on principles and concepts of mental health nursing. That is 10 hours. Unit 3 is about mental health assessment. Unit 4 is about therapeutic communication, nurse-patient relationship. Unit 5 is treatment modalities and therapies in mental disorders. Unit 6 is about nursing management of patient with schizophrenia and other psychotic disorders. Unit 7 is nursing management of patient with mood disorders. Unit 8 is nursing management of patient with neurotic stress-related and somatization disorders. So the books which you are supposed to refer is Townsend, Mary C. Townsend, Stewart, ICD-10 class. For mental health nursing clinical practicals, you have 80 hours of practical hours. At the end of the course, the student will be able to assess the patient with mental health problems and disorders, observe and assist in the various treatment modalities and therapies. So these are the clinical requirements. You will be posted in psychiatric OPD for 1 week, and you have history taking, a mental status examination 1, health education 1, and observation of the report of the OPD. And in the inpatient ward for 2 weeks, there you will give care to 2 to 3 patients with various mental disorders. Care plan 1, process recording 1, and you have to maintain a drug book also. For community health nursing in semester 5, you have 160 hours of clinical postings, and lab is for there's no lab, it's 160 hours of clinical posting. So at the end you should learn about the concepts and determinants of health. Theory is for 100 hours. So this is a unit 1, concepts of community health and community health nursing. Unit 2 is healthcare planning and organization of healthcare of various units. Then you have unit 3 regarding environmental science, environmental health and sanitation for 15 hours theory. Also lengthy unit. Then you have nutritional assessment and nutritional education, 7 hours theory. Then you have communication management and health education. Then you have community health nursing, approaches, concepts for 7 hours, 7 theories. Then assisting individuals and families to promote and maintain their health. So these are the various theories you have to complete. Then unit 8 is for introduction to epidemiology, epidemiological approaches, communicable diseases and nutritional health programs, is for 15 hours theory. Then you have non-communicable diseases and national health for 15 hours theory. And you have unit 11 for school health services, it is for 3 hours theory. So these are the recommended textbooks like Park, Surya Kanta, Kadri, Rajiv Balbar, Swankar, Gulam. So these are the various textbooks recommended for community health nursing in the syllabus. Clinical practical, you have 160 hours. So at the end, you should build and maintain rapport, identify the socio-demographic characteristics, health determinants and the sources of rural and urban communities, participate in the functioning of PHC, CHC, family welfare centers. So this is the 40 hours of clinical for 4 weeks, 40 hours per week. The clinical area, you have urban community and rural community as well. 2 weeks urban and 2 weeks rural communities, which are the requirements. You have to do a community assessment or survey in the rural area, field visits, various field visits you have to complete. Then health teaching, use of audiovisual aids, flashcards, posters, health assessment of women, infant. Then document and maintain individual records, family health records, screening, diagnosing, primary management and referral. So all these things you have to do. And next is the educational technology or nursing education. In semester 5 you have 2 credits, that is 40 hours of theory hours, lab is for 40 hours. So here on completion of the course, the student will be able to develop basic understanding of theoretical foundations and principles of teaching and learning, identify the latest approaches of education and learning, initiate self-assessment, identify one's own learning styles, demonstrate, utilize active learning strategies that enhance critical thinking. Course outline, introduction and theoretical foundation, that is for 6 theory. Then assessment and planning. Third is curriculum planning. For third unit is implementation, teaching in classroom and skill lab. Then fourth is teaching in the clinical settings, teaching various teaching methods. Then fifth unit is educational teaching media. So these are the various textbooks recommended for nursing education. Shankara Narayan, Neeraja, Hedda Venkatesan, Jasper Kaur Southi, J.C. Agarwal, Suresh Sharma, Clement. So you can go through these various textbooks. Then 40 hours you have Introduction to Forensic Nursing and Indian Laws is 20 hours theory. So here you have Introduction to Forensic Science, Definition History, then Forensic Nurse Definition, Scope, then Forensic Team, Comprehensive Forensic Nursing, Care of Victim and Family, Evidence Preservation, Role of Nurse. The Unit 4 is Introduction of Indian Constitution, Fundamental Rights, Scope of Laws and Lawmaking Powers, Civil and Criminal Law Procedures. So total 20 hours of forensic nursing. These are the various books: Virginia, Ignatius, Gautam, Vishwas, Jonathan, Montgomery, Chandrasekharan Pillai, Sarita Stevens. These are the various textbooks for semester 5. You have this is the pattern of examination. You can see for child health nursing you have continuous assessment for 10 marks, and the sessional examination 15 marks, total 25 marks. And for mental health nursing, it is 10 marks continuous assessment, sessional exam and practical 15 marks, total 25 marks. For community health nursing also 10 marks for continuous assessment, and practical and theory internal examination 15 marks. Introduction to Forensic Nursing also 10 marks and 15 marks to 25 marks. Child health nursing also practical also same way, internal assessment 10 marks, 15 marks and 25 marks. Mental health nursing and community health nursing, it is for 20 marks and 30 marks, and sessional theory and practical. Now let us see the 5th semester. For 5th semester, when we calculate the final examination, 5th semester you have community health nursing examination, educational technology, and introduction to forensic nursing as internal examination. For theory, you have 75 marks university examination, and for community health nursing. For education also 75 marks, 3 hours you have university examination. For introduction to forensic nursing you will have only end semester examination. For mental health nursing you will be having exam in the 6th semester only. So in the end of the 5th semester you have university examination for only 2 subjects, that is for community health nursing and education technology.